Today, we are here for the mental health panel discussing the ways COVID has affected mental health of both adults and children in the Kennebec Valley. Both the short-term and long-term effects have impacted many parts of our lives, and many aren't aware of how it's affected our mental health overall. So I'll be posing a series of questions for our panelists, but encourage those watching to type questions into the chat so that we can address them. If they're pertaining kind of to the topic at hand, we'll bring them up right then. And if it's more of a generic question or something that isn't part of that question, we'll leave time at the end to be able to answer those questions as well. So I'd like to ask our three panelists to introduce themselves and talk a little bit about why they chose a career in mental health. And let's start with Mike Mitchell.
Good morning, everybody. My name is Mike Mitchell. I am the Chief Executive Officer at Crisis and Counseling. We are celebrating our 50+1 year, and I have been with the agency for going on 17 years. Prior to being the CEO, I was the clinical director here, and I am a licensed clinical social worker who also was in private practice prior to that for about 13 years. So I came from a clinical perspective and have been with the agency administratively during that time, as well as continued to work as a clinician until I became CEO. Our agency provides comprehensive behavioral health services, mental health, substance use, med management, case management, etc. We also are the agency that parents or houses the GEAR Parent Network, which is a statewide network of support parent to parent for parents who have kids with behavioral health concerns. And we are also the crisis service provider for Kennebec and Somerset counties. We serve about 6,000 to 7,000 people a year through that service, working with local law enforcement, clinicians, hospitals, and the general community, and trying to respond as effectively as possible to mental health concerns. I came into the field of mental health. I was interested in high school in psychology, but I thought I was going to be the next Doc Severinsen. So I was a jazz musician first and studied jazz here at Augusta at UMA, and then went to the University of Miami. And then when I realized that wasn't going to happen, I switched back to my other love, which was psychology, and got a degree at NYU. And then I said, okay, now what am I going to do with a bachelor's degree in psychology? And so decided to go into social work because I really wanted to be a clinician, a therapist rather. And so have continued to practice clinically, both in home, in the community, private practice, and then coming into the agency. And the passion was about finding ways to be creatively helpful and trying to find ways in which to capture the magic in a bottle, to help people find ways in which to find better ways of their lives, and being a partner in that effort. So here I am.
Great, thank you, Mike. Dr. Janine Taylor.
Hi, good morning. Thank you for having me. So I am a child psychiatrist, and I work at Kennebec Behavioral Health, which is 60 years old this year. And we, as Crisis and Counseling, also offer a broad array of services. I have also been at KBH for 17 and a half years, and for the last 3 to 4 years as the medical director, in addition to continuing my clinical work. So I have an active caseload of patients still doing new evals. And I got into mental health because I was initially trained as a pediatrician. And when working as a general pediatrician, I realized that much of what I was seeing in the office was in fact behavioral health related, and I didn't feel well equipped as a pediatrician. So I decided to go back and get the training to become a child psychiatrist. I also have 7 children of my own, and 1 grandchild. So, and sometimes I think I'm the queen of crazy town myself. So, but I just enjoy, for me, it's a privilege to be able to accompany families on their journey along the way. And sometimes we're just white knuckling through it together, and then it's rewarding to come out on the other side. So I appreciate the opportunity to be here this morning. Thank you.
Thank you, Dr. Taylor. And Kristel Thyrring.
Hello, I am Kristel Thyrring. My pronouns are she, her. I am from NAMI, Maine. I am the Youth Programs Director, and I'm very pleased to be here today, and especially getting to sit on a panel with Mike and Janine as well. I've worked with both of their agencies in the direct service capacity and have so much respect for what both of them are doing. I am relatively new to NAMI's agency. We work mostly on support, education, advocacy for the 1 in 4 Mainers that are impacted by mental health. And I joined the agency back in the summer of 2020, and prior to that was in child welfare. And I think that's really what's brought me to the mental health field, is having seen the impact of mental health on our young people and knowing that we have such vulnerable populations of not only being a young person, but compounded with trauma, how that impacts their opportunities moving into adulthood.
Great. Thank you so much, Kristel. So I guess we will jump right into questions for our panelists. Let's start with Dr. Taylor. What would you say have been the most significant effects of COVID on the mental health of our community, both for children and adults?
So I think it's been broad and varied. I think some of the major impact has been just on the uncertainty and the lack of clarity. So we talk about, do you remember where you were when, fill in the blank? Do you remember where you were when COVID first happened? And I do. I remember the date and what a nightmare it was for us in terms of figuring out what to do and how to respond, and how guidance, we'd be in the middle of sending out an email and the guidance would change and the email would be obsolete. So just having to deal with a lot of information, a large volume information that seems to contradict itself, knowing what's the right thing to do. So that sort of general sense of uncertainty, none of us has lived through a pandemic before, and sort of who can you trust, who's got the right information. Other impacts have come from disruption to what's usual for us, whether that's how we go to school, how we go to work, how we celebrate family gatherings, how do we mark funerals. So some of our normal milestones and markers and traditions have been really disrupted. And then things related to this whole have to work full time and do homeschooling, or different roles that we have to take on, different things to juggle, financial insecurity. It's affected people's jobs, whether they don't have a job or their hours have cut back. And even if you have the financial recompense in the form of unemployment, what does that do to your sense of self? If the way you've identified yourself and the parameters in which you're used to being have now shifted, how do you reconfigure and make that different? And then, the impact on treatment. So whether that's not just mental health treatment, but physical treatment. So doctors' offices in the spring were shut down because we were readying for COVID. I know I had treatment of a condition that I have was delayed by 6 weeks because of COVID. People being afraid to go to the hospital. Some of my patients where I need certain labs for certain meds I'm prescribing, they were afraid to go to the lab and get them done, which impacts treatment. Some of my patients who get ancillary services in the form of occupational therapy or physical therapy, and let's say those services were available remote only, and that modality didn't work for those kiddos. Or there's technological difficulties. I just this morning, an appointment right before this, they were standing on their porch because that's where they could get the phone signal. Never mind Zoom. We were just doing the phone, and they couldn't come because they had been out of state, and so they were in the quarantine period. And so just some of these unique challenges to how we do everyday things, and then how we get the extra things that we need.
Great, thank you. Mike or Kristel, is there anything you'd like to add?
I thought Janine covered it very nicely. It's pretty comprehensive of the state of uncertainty. Just when you think you have it nailed down, That's true for whichever side of the room you're on, because from an administrative staff perspective, the uncertainty also is affecting everybody.
Great.
And I would agree with both very much so. I am definitely from the strength-based approach to things, so I've been really encouraged with the normalization of the discussion of mental health, especially with young people. I look at so many young adults that had it in their mind that you turn 18 and you have this wealth of knowledge that you are an adult and you're done and you're ready, but really being so open and frank with our young people that their teachers are struggling, their providers are having a hard time. So it's not just that they're young and experiencing this, it's a normal human condition. As well as I think the importance of shining the light on the discrepancies of access to technology, like Dr. Taylor referenced, standing out on the porch. There are so many locations across the state that even if we get a laptop to folks, there may not be internet that is powerful enough to be able to provide the service. And I don't think that's a discussion that I had prior to the pandemic. So I'm encouraged that we're having more frank and open discussions about these kind of things.
Great, thank you. Kristel, I think we'll stick with you for this next one. Has the pandemic increased the number of people using your services?
I would say yes, because the more open discussions with mental health, I think that there have been a lot more outreach to NAMI Maine, looking for information and looking for resources. I've had waves of requests from schools initially when we were first getting back to school and folks weren't sure if this was going to be remote or every other day something different, which seems to be more the case. I appreciate that these facilities or schools that are serving our young people as well as community members are asking for help and are reaching out and wanting to know more on how to support each other.
Dr. Taylor, would you like to add anything to that or the services at your agency?
Sure. So what we saw at KBH initially was there was actually a decrease in referrals, and it was actually dramatic. And then since then, numbers have returned to normal, if you will, to kind of what's typical. In terms of people's level of distress and kind of the reason for referral, what they sort of noticed in the access center was more along fall is when people seemed to be more distressed, like the reality was sinking in, like that whole notion of, well, maybe this is temporary, or surely by the time school restarts, right? I read some retweet somewhere where it says when COVID is over, it's starting to sound like ... and you fill in the thing like, whatever, some unrealistic thing, like I'm going to say yes to my kids, or when snow melts wherever. But so the reality sunk in, and what we've seen the biggest increase for has actually been related to kiddos and adolescents. And again, I think the reality of school and many kids are struggling with that, and their parents, and particularly kiddos who have individualized education plans or they get extra support, how to give them that extra support remotely or on the every other day. Some schools have had to go so far as to provide hotspots. One of my patients, the school gave them a hotspot because they were having such technological issues. So that's kind of the pattern that we've observed.
Great, thank you. Mike, can you speak to that question, but also include whether or not you've seen increases in the number of cases that have been reopened or people returning to therapy because of COVID?
We've seen both across the board, so that the numbers, as Dr. Taylor pointed out, at first they fell off the charts, and we didn't have really any service activity for a better part of 4 to 6 weeks. But since then it has increased. And I think what we can also see is this is going in stages. The longer that the pandemic is holding us in its grip, I think people are having different reactions, and different folk are struggling in different ways. People with serious and persistent mental health concerns have increasingly had a hard time. And so we're seeing a lot more acuity, a lot more complexity We are seeing issues of substance use go up dramatically, suicidal concerns across the board, as well as kids struggling with really kind of, if they have been already in a difficult home environment, if they have already been in a situation where school or getting out into the public was a way in which to kind of refresh, that's blocked at this point. So kids who are really struggling with that, we're seeing across the board similar kinds of concerns.
So many of you work with individuals with substance use disorder. What are some of the other ways COVID has had an impact on those substance use disorders? Seeing an increase in new cases?
Yeah, I mean, think about it. I mean, we've been in this box for almost a year now, and people who at this point have fragile coping skills under stress and difficulty have been stretched to the max, as we all have. But if substance is something that has been either previously available to you as a coping mechanism, or that's where you go, then the pressure and the uncertainty kind of reinforces that momentum. And so we're seeing across the board use, alcohol, of course, always being the top substance that we're concerned about. But unfortunately, there's been a lot of overdoses and a lot of people who are right at the edge in ways that seem to be exponentially growing as the longer this continues to go forward. We're also seeing youth and adolescents increase in substance use as well. In a way that in many respects is outpacing our capacity to respond because of lack of staffing. And frankly, technology is not sophisticated enough to really make this work. I think we've hit the wall as far as we said, prior to this happening, we were saying, okay, so how can we use technology to enhance the service? And then we were shot through a cannon to use this service. And I think we've now seen, okay, this is pretty much the max. And it doesn't engage everybody. Kids who are struggling with impulsivity issues or concentration issues, people who are dealing with trauma or interpersonal concerns, this format doesn't work well. And so, we are now feeling that pressure to get back into face-to-face as a service delivery in order to re-engage and then find some creative ways to use technology that we weren't really doing before.
Thank you. Dr. Taylor, would you like to add anything, or Kristel?
Yeah, I would second everything that Mike has said, and I think the referrals coming in or reopenings aren't necessarily with the explicitly stated reason for substance use or addiction issues, but finding that more sort of tangled up in everything else. And I think sort of one of our issues with people coming back or people coming in for the first time with the technology is so we don't have to worry about transportation anymore. But then there's other things like childcare. So who's running around in the background? Is it safe? Do they have a safe place at home? Particularly if there's domestic violence or other abuse, like who's there in the background? Even if that's not a concern, I have a concern as a provider. Sometimes I'm particularly not all of them can do Zoom. So then if it's phone, and then I'm like, wait, who's there with you? Like some of them are riding to get ice cream or they have other people there and they're like, oh, it's okay. I don't mind if they're there. But those people would never be in an appointment in my office, And so, and what's going on? How attentive are they? Some of them they're playing video games while they're talking to me, and I haven't, and the parent rats them out, so just a lot of challenges to manage on either end, no matter what the issue. And I think, typical healthy coping strategies are maybe not available, and so then that leaves lots of room for maladaptive strategies. And online meetings aren't the same as face-to-face meetings, and not everybody has the technology to access those.
Caitlin, if I could just, I forgot to respond to the part about people returning. We are seeing people returning back, and sometimes as a way in which to reconnect when they can't otherwise do it. So yeah, we are seeing people who we previously have been involved with because of either relapses or because they're trying to find some resource to get through this prolonged storm, if you will.
Mhm. Thank you. Kristel, have you seen any increases with substance use disorders or new cases, reopened cases with youth?
I look at this one through my child welfare history lens of, I think of so many young people in foster care that bouncing throughout the state in placements, unfortunately. And so we have such limited minor access to substance use treatment programs. We have one facility for young men in Fairfield, for instance. However, if they're not in if a potential client is not in a position to be able to quarantine the appropriate amount of time, or at least this is going back several months, they may have changed protocols, or if they are not at a specific developmental learning level, they may not have access to that same treatment that somebody else might. And so, like Dr. Taylor had said, yes, transportation is no longer a barrier, but if you have young people that are experiencing substance use problems and they don't have a stable adult in their life that's helping them make sure that they get to their Zoom appointments, that they are focused and paying attention or engaging with their provider, then yes, the service is there and yes, the person is open for it, but are they getting what they need out of it?
Great, thank you. Mike, this question will be for you. What impacts has social distancing and isolation have on a person's mental health?
Well, I think we couldn't have got a more crystal clear example of why we are a social animal. We thrive on interaction and relationship, proximity in particular. And so, there's many aspects of this physical distancing that not only keep you on edge. I mean, I don't know about you folks, but there are times in my dreams, I'll have a dream that I forgot my mask or something, so this stuff is permeating into our psyche and changing the way we're thinking about relationships. Watch a television show and I'll be saying to my wife, they're standing a little too close to each other. There's this vigilance that's in there now, and it's about the other person and about you. Am I doing this to them? Are they doing this to me in a way that never really was a part of our thinking before? It also has it so that people are contained in their bubble, so that where there may have been relief before or breaks, some folk are staying connected in a way that stretches the limits of that relationship beyond what previously had been there. So in both directions, the disconnection, but also the way in which the bubble is creating a containment of certain relationships as well. And we're seeing that both in just general stress and anxiety, but also the extremes of domestic violence and substance use.
Dr. Taylor, can you speak to that as well?
Yes, I think, and I'm going to sort of throw a monkey wrench in. Nothing is globally true. So I've had some folk where they've seen this as a boon, because my people who are very socially anxious, well, it's now culturally sanctioned to not be socializing. So they're like, wee-ha, one kid in particular, he's like 19, and he's like, now I don't have to think what to wear, what to put on. I don't have to worry, what does my hair look like, unless we're doing Zoom, and I sort of drag people in and make them come face to face anyway, because as a prescriber prescribing medication, I like to have things like vital signs and maybe a urine drug screen and some other things. But for him, it's like, oh, that's so much pressure taken off me. And no one's going to be pushing me to get out because we're not supposed to be going out. So for some people, it's actually been a gain. But I think another thing that we're seeing sort of a pandemic of is the issue of loneliness. And I think that sort of loneliness and isolation, particularly for those who live alone. I mean, some of us might wish we did live alone sometimes when it might be hectic and noisy and chaotic in the household, but for people who live alone, how are they getting out to get their groceries? How are they getting, who's checking on them, sort of takes on more importance, maybe the elderly, other people who live alone, and we can't visit them. My 87-year-old mother, who's like, it's really hard not having any visitors. I'm like, well, I'm not going to go visit you and possibly bring you COVID, or get it from, so that sort of loneliness and isolation, I think is problematic for many.
Kristel, have you seen kind of transitioning a similar question and part of what Dr. Taylor was talking about how the pandemic has affected those people living alone and having to be isolated?
I think it's really called on a lot of people's ability to be creative. I've spoken with organizations that have set up phone trees for elderly adults that are living alone or living in a more isolated environment. And the phone trees have actually developed like closer relationships for the people that are participating, and the people that are volunteering to help these others are finding connection and satisfaction themselves. And so I think that finding service out of this has been what I've noticed the difference for people between being isolated and feeling lonely and at a loss so often versus folks that have been able to find a tangible use that they can put themselves to have been reporting better outcomes so far that I've encountered.
Thank you. Mike, would you like to add anything to that question of those living alone?
Yeah, I think in particular for elderly folk who don't have easy access, and how much family ritual and family tradition has been really dramatically impacted by this, and how that affects some of us more than others. As Janine pointed out, there some people say, thank you very much. I'm glad that I don't have to do this. And of course, there's very, very real limits about how you can do certain levels of connection, televideo or otherwise. Unfortunately, my dad passed away during this time, and I hadn't seen him. He passed away in December, and I hadn't seen him since August. And so that stuff is very real, because life continues on, and if you don't have those resources in a way that's more accessible to us, yeah, it takes its toll.
Thank you. So let's have this go to Dr. Taylor. Have you seen any aspects of the pandemic that have had a positive effect on mental health?
Well, and I think there's opportunity for that. And like so many other things, right, we have some choice. So there's so much we don't have choice over. But other things that we do in terms of how we respond. So some people have, you know, been able to choose to do things differently as a family. So maybe they've talked about having less external activities to distract, and so they've spent more time doing family-focused or family-centered activities. Again, that's not a positive for everybody, but for some families, they've seen that really as a positive thing. I think one of you said, Kristel or Mike, I can't remember which, but forcing people to be more creative. I think it was Kristel. So people have had to be more creative about how are they going to make that happen? How are we going to have this social gathering, or how are we going to maintain our connections, and, you know, sort of pull together for a common goal and a common task. And those are good things. I think an equalizer per se, I mean, just in terms of adults that are struggling, and you know, sort of the universality of that, so that, hey, it's not just you, we're in this together. And I think you know, those are things that could be seen as a positive, but not everybody feels able to do that or has the resources to do that.
Thank you. We have some questions in the chat, but first I want to give Mike and Kristel a chance to answer that question about seeing any positive aspects of the pandemic. Mike, would you like to start?
Sure. I think that there are some positives here, in the sense that it has shown where some of the vulnerabilities in our system are. From an administrative perspective, it has forced us to really test the limits of our capacity to respond. You know, when we first had the lockdown in the spring, we were able to shift over in 6 days. Now, if you had asked me that this time last year, I would not have dreamed that we could have pulled that off. But, you know, people have been creative and responsive throughout this year in a way that have just been remarkable. to be able to continue to keep things flowing and to keep business going. Our employees have just really stepped up in an amazing way and create a sense of team, I think, around it as well, a sense of continuity and togetherness with it. So I think that that's also a positive. And the technology, it's given us an opportunity to do something that we wouldn't have otherwise been able to do. So I think we'll see over time what that will be, but both the positives and the negatives will actually help us make better decisions about it.
And I wanted to, separate from that, Caitlin, maybe before or after we get to those other questions, I thought a couple of the questions you sent would be good for us to speak in terms of what can people do and what might be signs that someone is struggling. So those were a couple of the questions you had sent to the panel, and I thought it might be useful for people to hear us respond to those if that works for you guys in the overall frame of how we're flowing and what we're doing. I'm sorry to be bossy.
No, not at all. Thank you. I appreciate the feedback, and we'll be sure to get to those as well. Definitely. Kristel, did you want to talk about any positive lessons that have come out of the pandemic?
Yes, and I think I can actually tie into what Dr. Taylor brought up. Intentionality. In pre-COVID times, we can just drop in on a friend, see them, hey, how's it going? And we take that everything's fine at face value and keep moving through our day. Right now, when we see people in person, half of their face is covered up. We don't know what that expression is. And so you really have to commit to asking, how are you doing? Reading the tone, reading posture, reading so many more of the nonverbal cues that we took for granted prior to this. And really having to slow down and think about, how am I going to execute this plan of, I'm feeling lonely today? How am I going to remedy that? How am I going to connect with somebody? It's, say, 30 degrees outside. We have to adapt differently than what we did during summer. And I think that really making sure to acknowledge our own limitations and be compassionate to those around us that are having days when they're not going to be at their best, and just being very open and transparent with that not every day is going to be a wonderful day, but figuring out what your coping skills are and what those strengths are in your life that you can rely on and that you can pull out on a hard day, I think is the best that we're going to do out of this.
Great, thank you. Kristel, I'm going to come back to you for one of the questions from the chat. Was I would like to know how Zoom is affecting our youth.
I think that has so many positives, surprisingly, and unfortunately just as many negatives. Figuring out how to engage with our young people over Zoom has been wild. And every organization or every contact is going to be a little bit different. Like Mike or Dr. Taylor engaging with a youth is going to be different than me dropping in for a presentation or school person. And so I think that people have been, again, very creative with approaches. I have learned Zoom games, which were never something I thought I would know how to facilitate or that would exist. And I think that there's an opportunity for young people to speak up in different ways that they might not in person. But just as Dr. Taylor had referenced, you never know what's going on outside of the frame. If somebody is telling you everything's fine, that could mean that everything's fine, or they have somebody within earshot that it's not safe to speak up. I think that schools have done their absolute best to try and plan around this. I have seen some schools that have a mandatory check-in on, say, Wednesdays, that young people, even if they're 100% remote, are required at 1 o'clock to check in with a person by video. And they have a good lengthy discussion and have any kind of follow-up that's needed from there. If a young person misses that appointment for whatever reason, they have to come in person and obviously socially distanced. But if somebody doesn't show up, then having either a school staff person or an SRO, school resource officer, actually go out in person. Because the biggest drop-off that we've seen is the young people that just aren't on Zoom, that just either they showed up the first day of school and we haven't seen them since, or some fusion of that. And so it's scary knowing that we have young people out there that we're not reaching, but I think that we have made incredible improvements on the ones that we are reaching.
Thank you. Mike, I'll have this one directed to you. This came from our chat. Do you have any suggestions for phone and virtual connection when there isn't much to say or talk about, like when trying to stay connected with family, in particular older family members?
So my experience with it right now is kind of working with clinicians who are dealing with this frustration that it's hard enough to engage kids who don't want to be in a session when they're in front of you, but to do that virtually adds to the challenge. And yeah, there are ways in which you're going to have to use the technology to its advantage, either through activities or whatnot. But there are times in which you have to pace it and understand that it's much more of a marathon than it is a sprint. And so waiting and kind of working with that kid and adolescent to find where their pace is and what is motivating them to feel better, to feel something that is important to them, and trying to find that alliance leverage that is important is going to be the same whether they were in front of you or if they were virtual. It's just you're missing that subtlety that you would have having them right in front of you. The technology is not anywhere near enough to be able to let us see that. But, you know, kids who are struggling with trauma or kids who have different domestic violence issues in the home, it's going to be hard for them to concentrate or focus in that environment. And so it may very well be that there has to be an alternative that's private, that's safe for them, and something that's more accessible. I also can see that there are times in which the technology is actually an advantage because it does allow for some level of emotional distance so that you are able to perhaps manage certain things that you might not otherwise do as readily if you were sitting in front of somebody. So there are some clinical benefits to it that they don't outweigh some of the negatives, but they are something that we can perhaps consider in future planning and how we're going to move on from here.
Thank you. Dr. Taylor or Kristel, would you like to add anything?
Well, I would say that outside of a clinical or maybe not, but just sort of even with older family members, connection is not to forget good old-fashioned snail mail. And so, you know, getting something in the mail, just a little note, a little card, just some way of connection. And then sometimes that can foster something to talk about. But I would say also for the technology within appointments, you know, face-to-face is not the same now because they don't have toys in my office the way I did because I can't deal with having to clean them. so in the office, and we all have masks on, so it's you know, clinical information I would rely on is blocked, and I can't use my face as much to engage people. And like Mike said, I would agree there have been some advantages. I have one kiddo who on a Zoom appointment, we had like face-to-face direct eye contact, but in my appointments, he's always sitting to the side. So I said, wow, this is great. We've got face-to-face eye contact, you know, whether that was the emotional distance or just, you know, where he was in front of the camera relative to where he is in the office. So, and another kiddo was you know, and I've heard some of my colleagues say the kiddos will hey, do you want to see my fill in the blank, my cat, my bed, this cool project I just finished, whatever. So then we are able to see things we wouldn't be able to see necessarily for face-to-face.
And I think connecting with folks when we feel like we've exhausted all of the communication topics or all of the regular topics we go through, I've heard about some folks that, you know, grandparents are reading a book with their grandkids over the phone, and both of them have a copy of the book and they go through it together. And that kind of takes down the pressure of having to have an interesting conversation, or even just acknowledging the limitations of, you know, we've talked a lot. I don't have anything interesting to say, but I can tell you about this really cool plant that's in my yard right now. Just meeting people where they're at.
Great, thank you. Kristel, I might come back to you for this one. What are some social issues being highlighted by the pandemic?
So many discrepancies, whether it be access to services, access to insurance. The Black Lives Matter movement all of the news coverage that we've had, there's been just an opportunity for people to slow down and not be moving through their communities as much, and being able to see that, hey, things aren't exactly how I thought they were necessarily. And hopefully this is an opportunity that we can start working on improving some of our systems, that when we see that not everybody is having internet speeds that are available to be able to access telehealth, hopefully we can make a change on that. If we're seeing that a certain population of students aren't able to get to school on the days that they need to be there in person, let's figure out what that causes from. We see food insecurity discussed a whole lot more. I think back to earlier this year, or I guess end of last year, that there was a FDA, the food box, or USDA food box that was available for folks. And the line in Augusta was miles long. And driving by the food bank for years, nearly every day, I had never seen a line like that before. And so it's put so many problems that have always been there just out in the forefront and forcing it into the public eye. And it's important that we meet these things head on.
Great, thank you. Dr. Taylor or Mike, would you like to add anything?
Go ahead, Janine.
I think that was well said, and I think a big thing for many families with school kiddos is that food insecurity and the reliance on the school, and how schools got creative to address that. So they were running the buses and dropping off the meals, at the bus stop, and sort of having the mask on, and people picking it up off the bus. And then, trying to figure out how to get food to the families who relied on the school. Absolutely.
I would add that I think that it has provided opportunity to lower the stigma around behavioral health some, because of the general across the board conversations about reaching out for help and support. So I think that has helped to a certain degree. Whether it'll be followed up and we will be able to capture that momentum is another story altogether. But I think it also highlights some of the weaknesses in our society in which we're under stress. And sometimes it's the people who are paid the least and have the least available to them who are at the highest risk. And we've tried to look at that in our organization to try to find ways to offset that to some degree. But it's just a sad reality. And of course, whether it's poverty or race or gender or all those things, anything that we were dealing with as a society before now has been magnified by the intensity of this.
Mike, I'm going to come back to you with the next question, and we do have a question in our chat, but I will get back to that after this one, just because it has to do with a little bit of what you talked about. So we know that access to counseling services isn't always as easy as it should be. Are there free counseling services that are offered remotely?
Yes and no. That there are monies available in a variety of ways. The pandemic has freed up some. The Office of Behavioral Health in Maine has been able to do some cost savings, and so they've had some level of funding there, but that's within the context of the fact that the system was already underfunded and under-supported before this all happened. And so it's been really stretched, and so therefore access numbers of staff available. I mean, we've had services that are under functioning simply because we're not able to fill vacancies because we had a workforce shortage before this all happened. And a lot of it had to do with not only the population issues, but just because we're not paying a competitive wage because it just doesn't support that. And so it really highlights just exactly what does our society want? What do we want from our behavioral health system? And are we going to weave it in a way that is, in some respects, similar to what we might do to law enforcement or the fire department or something, so that we have services that say, this is part of our community. This is something that we can assume is going to be a baseline level of support because we know it's essential.
Thank you. Kristel, would you like to add?
To add what Mike said, I would say that at least 5 times a week we get a call on our helpline with someone looking for access to mental health treatment. They're acknowledging that either themselves or a loved one is having a very hard time and are either heading towards crisis or having to refer right over to there. And knowing that people are taking all the right steps and doing the right things by reaching out and asking for help. And if you don't have the financial resources to get the help, it ends up being such a reactive process, which is more expensive in the long run, which is important, but that's another argument. But it's very frustrating that people are asking for help and we don't always have something to give them.
Dr. Taylor, would you like to add anything?
Sure. I would say, ditto to what Kristel and Mike have said already. I know at KBH we do have some grant funding that allows us to provide services to uninsured or underinsured, but those dollars are limited and sometimes they come with strings attached for us. Like in order for people to receive them, there are certain criteria that have to be met. One of my colleagues had sent us all an email about some sort of digital therapeutic apps, which have had some FDA approval. I mean, of course, apps are never a replacement for more extensive treatment. And I don't know, some of these, I'm sorry, I'm looking down at my paper, some of these, I don't know how much some of them cost, or some of them might be free. I see.
Some of them are.
Yeah. So anyway, there's a few having to do with, one is called Breathe to Relax, which teaches deep breathing techniques. There's another one, a CBT for insomnia app. That one is free. There's one about Stop, Breathe, and Think. There's MediSafe, which is one about taking med compliance, helping people to remember to take their medications. And I think there's a free version and then one that's a little more. So, but yeah, there are workbooks and, but yeah, it's really challenging for those who are uninsured and underinsured. And even those who are insured, right? Because even if you're insured, maybe the copay is prohibitive or people have high deductible plans. And so they have to pay I have to pay the first $3,000 out of pocket for my insurance plan. If somebody doesn't have the wherewithal to do that, they're gonna not want to seek treatment. And then once they've met their deductible, then they'll want all their treatment. So until the new plan year starts, so.
Thank you. I do want to ask the question from the chat, and keeping in mind that we only have a few more minutes, and we definitely want to get to the questions at the end regarding what people can do if they're seeing someone experience mental health issues or having them themselves. But I do want to get to the question from the chat. Do any or all of you think that you will maintain a stronger telehealth platform once COVID is less of a concern? Or do you think you'll return to the previous model? Kristel.
Yes, I want to keep some of this available. We have adapted many of our trainings to being available virtually, and it's been incredible being able to have folks from Aroostook County all the way down to southern Maine that are able to be in a room together and have discussions about needs, and that cross representation is just incredible to grow knowledge base, and it's awesome that they don't have to travel.
Thank you. Mike?
Yeah, I would say that we have crossed a point of no return in some respects, that there are ways in which we'll be thinking about this. Clearly, we need less of a diet of it than we have right now, because there is lots of information that our brain is seeking out that cannot come across in a video screen. Yet at the same time, there are some things, as we're joking in our agency, that snow days now are a thing of the past now, because we're able to work in a variety of ways that we wouldn't have been able to do before. I also think that there are going to be creative ways in which we can enhance treatment with more mindful and less pandemic-driven ways in which to use technology. And of course, there will be innovation around the technology itself. Yes, there are the apps out there, and there's the Walmarts and others that are doing therapy in this kind of strange way. So other things are happening, but I think that there will be ways in which there will be mindful and attentive innovation that will even make this much more treatment and healing enhanced as we go forward.
Mike, I did want to throw in that I hope that you'll bring back the snow day for your staff.
Yeah, right.
We've had the same conversation, and I think that's bad news, frankly, because then, is there some expectation that we're available 24/7 always, because we can be, because of, and of course, if you lose power at home, you still can't work from home. But I think for KBH, our plan is definitely to continue this in some way. I mean, for the pandemic and the state of emergency, the rules are a lot looser than they will be outside of a non-pandemic with regard to privacy and confidentiality and so forth and so on. So I think we are envisioning there'll be a role for it, but it will not be probably Zoom, and phone appointments aren't likely to be paid for outside of a state of emergency, and that's a problem for people, and not everybody can do the technology. So yes, and even for some of our meetings, our complex case conferences, it's nice not to have to travel per se. I was able to do this today. I have something right before and something right after, and so I was able not to reschedule those things because this was by Zoom. So that's a benefit.
Great, thank you. Dr. Taylor, I'm going to come back to you for this last question. I want to make sure to get in and ask for you to talk broadly about some of the things that people can do to protect their mental health and support their well-being, and what are some of the signs that someone might be experiencing a mental health problem?
So I think, the broad things, and some have already been mentioned, are things that are important always, but extra important now. So to maintain some sort of consistent routine and structure, whatever that is, and it's not the same as it was, but to find some way, and I don't mean every day at 7:01 and 30 seconds you get up, but that there's a consistent and predictable routine, that you have some sort of stable base. And I really liked Kristel's point about we need to give ourselves grace and mercy, it's okay where we're at. It doesn't mean we're always going to be here. Getting proper exercise is so good for so many things: depression, anxiety, sleep, focus. Getting fresh air. I'm asking all my patients now, how much fresh air are you getting? Even if, and one kid told me, I'm getting plenty of fresh air, my window's open. But I mean like outside in the fresh air. Regular eating, right? Just sort of the basic self-care of proper sleep, proper nutrition, proper exercise. And then being transparent and open, not so much that we don't burden our kids with all the gory details, but, sort of being honest at their level, watching where we get our information from. Please don't spend all day watching the news or flipping from website to website. We'll drive ourselves crazy. Kind of limit, okay, every day at this time, I'm going to check this site and look for this information, and that's what I'm going to go by. So those are some. Take time to relax. It's okay. Look for opportunities to be playful, to have fun, to sort of put aside the heavy weight, and that's not frivolous. It's helpful. Looking for ways to help. Sometimes really helping and giving back can really bring back some meaning and purpose that might otherwise be lost. Signs that somebody might be having trouble. For kids and littles, this could be fussiness. It could be changes in their eating habits. It could be changes in their sleep. Maybe now they're coming into mom's and dad's bed every night. Maybe they go back on the bottle. Maybe they're not toileting as well. For older kids, you can see, and adults, you can see changes in mood, changes in behavior, maybe more risky, more impulsive choices, maybe not being interested in things they were, the hygiene. I mean, I know there's a point, right? If this is all that's showing, who cares what the rest of me looks like? I'm in my office, so are people keeping up with their hygiene? Are people coming out of their room? Are the curtains open? So how can we help people if we're seeing these kinds of things? It's okay to say it. It's okay to say, boy, I've noticed, whatever you've noticed, not attaching judgment to it, but just describing, boy, I notice you're spending a lot of time in your room. I notice those are the same pajamas you've had on for 3 days now. I notice your hair isn't in a braid the way it always, whatever it might be. And it's okay to share, boy, I'm concerned and I'm worried. Is there something I can do to help? How can I help? And please remember that you're never going to put ideas in somebody's head. So if you're worried if somebody is, in the worst case scenario, suicidal or having thoughts of wanting to die or be dead, you're asking that question isn't going to make somebody who wasn't thinking that think that. So that's a lot of times people are really worried and nervous about that, and they're afraid to ask. And again, I think it's you just preface it with, I'm just really concerned. And so they might get angry, they might get upset, they might say it's none of your business, don't worry about me, get out of my face, leave me alone. Sometimes that's all the more when you need to push back and just let them know that you're there for them and you're concerned.
Thank you, Dr. Taylor. And I know that we are at our time, but I really want to be able to allow Kristel and Mike to be able to respond to this question as well, just to make sure that everyone has all of the information. So Mike, can you speak to that question as well?
Yeah, what Dr. Taylor said. And also, trust your gut. That's very important. If you feel like something's not okay, trust it. Say something and don't try to push it aside. I've just posted the crisis response number, the statewide crisis response number. If indeed you are concerned in a place in which you feel like something needs to be done, by all means, that number is available 24/7 for someone to kind of process through with you, or whoever might be calling, as well as the possibility of having a crisis team involved directly. So if it comes to a place in which that your guts is saying there's something wrong, don't ignore it. Act.
Great, thank you, Mike. And Kristel?
I completely agree with both Dr. Taylor and Mike. And I think just really making sure that when have concerns about somebody using I statements, being very direct and non-judgmental, like Dr. Taylor had said. With calling crisis, I always tell people, don't screen yourself out. People feel like there is this threshold that you have to meet to make that call. If you feel like calling crisis is going to be helpful, please do. They will tell you if, that's kind of outside of our scope. And I think that really making sure that people are focusing on self-care outside of what the stereotypical self-care was prior to the pandemic. We might think of, go take a bubble bath or paint your toenails. That we really need to open up self-care to, whether that be the healthy activities or getting that fresh air that Dr. Taylor mentioned. It's important that we all follow those things, make a plan and stick to it.
Great, thank you. Thank you so much, everyone, for being here today and being a part of this discussion. And a huge thank you to Dr. Taylor, Kristel, and Mike. We're so thankful for you joining us today and sharing your wisdom. And we hope to have another event like this in the next couple months, so stay tuned. And other than that, thank you, everyone. Have a good rest of your day.
Thank you all so much.